Good evening, everyone. My name is Angela Fullwood, and I am the supervisor for family and community engagement. And we are so excited to start our Black History Month Parent Power Hour series with breaking mental health and community and all of the barriers in communities of color. This is a panel discussion, and our goal really with this session is to start a conversation about mental health and African Americans, really by first sharing some information. So we hope during this conversation to help people recognize the signs and the symptoms of mental illness, particularly depression and stress in Blacks, but especially in African American men and our young adults. We want you all to understand what you can do really to help yourselves and your loved ones who may be dealing with mental health issues. So I'm going to turn it over to my director, Dr. Felita Lewis, to introduce this amazing panel that we have. Dr. Lewis.
Good evening, and thank you, Mrs. Fullwood. And we really appreciate all of the participants for joining us today for this first part of the four-part series of spotlighting Black health and wellness as a part of our monthly series with Black health and wellness, spotlighting Blacks. But we just want to thank our parents and community members for joining us tonight. So I am going to start with introducing our panelists, and I will disengage with my camera just so that I can focus and don't miss all of those very important credentials that we want to share. So I will start off with introducing Dr. Sharon Andrews Gray, MD, MPH, psychiatrist at James A. Haley VA Hospital in the area of VA Psychosocial Rehabilitation and Recovery Center. She has a degree from Spelman College. She has an MPH, and she's a doctor of medicine from Meharry Medical College. She has 20 plus years of experience, and her area of specialty is psychiatry. Next, we will have Dr. Marquita Wills. She is the Chief Medical Officer at Johns Hopkins Healthcare. She attended school at the medical school at the University of Pennsylvania School of Medicine. She has an MD and an MBA. She has 20 plus years of practice, and her area of practice and specialties include being an adult psychiatrist. And next, we will share with you our HCPS team, and we're really glad to have our partners from within the school district to support this work. We have Ms. Shanshira Quinn, who is a supervisor of middle school counseling. She attended the University of South Florida and Florida A&M University. She has an MA in counseling and a BA in psychology. She has 25 years plus as a practitioner, and her area of specialty includes middle school counseling. We also have with us Ms. Ann Townsend, who has a specialist degree, and she's a supervisor for HCPS in the area of psychological services. She attended the University of Florida, go Gators, undergrad and graduate degrees, the University of South Florida, go Bulls, educational leadership, and her degrees include having a bachelor in psychology, a master's in school psychology, and she has an educational specialist in school psychology. She has 29 years of practice, and her areas of specialties include being a nationally certified school psychologist with the National Association of School Psychologists, a licensed school psychologist from the Florida Department of Health, certified school psychologist with the Florida Department of Education. She has an endorsement in educational leadership from the Florida Department of Education, and her interests include intellectual disabilities, disproportionality of students in special education and gifted programs. And then we finish off the panel with Dr. Maria Russ, supervisor of school health services for HCPS. She attended the University of South Florida, go Bulls, and she has a PhD degree, MSN and BSN in nursing science. And she brings to us 31 years of practice within the field. And her practice and area of specialties include pediatrics and adolescents. Ladies and gentlemen, we share with you this panel of experts who will be talking with you tonight as it relates to Black health and wellness.
Thank you so much, Dr. Lewis, for the introduction of this amazing group of women that we have on this call today. So really mental health is a topic that many African Americans really consider in our culture taboo, and we really don't often discuss it. And in doing my research, depression is one of the most common mental illnesses, but it is an under-recognized and undertreated problem among a lot of African Americans. Um, I looked at some data, and about 1 in 5 Americans struggle with mental illness at any given year, regardless of their race. And African Americans are 20% more likely to have serious psychological distress than their white counterparts. And, suicide is the third leading cause of death among African Americans ages 15 to 24. Less than half of all Americans with mental disorder get the treatment that they need, but the proportion of African Americans who need mental health treatment and get it is only half of their, again, white counterparts. In my studies, African American men are 4 times more likely to die by suicide than African American women are. And it is clear that depression is a serious problem for African American men. Ignoring those problems or pretending that they don't exist really, it's not going to make it go away. And so, in the light of the recent passing by suicide of former Miss America USA and Regina King's son, now more than ever, we really need to have a laser focus on everyone's mental health, but in particularly the mental health and wellness of people of color, and especially our younger generation. So with that being said, I want to put it out there to the panel. Let's talk about this. When we talk about mental health, what is mental health?
I can take that if that's okay. And this is Shanshira speaking. When you think about mental health, you oftentimes think about like the quality of life. So pretty much having a positive quality of life and thinking about how we handle and cope with stress, how we make choices, and just thinking about our emotional state, our psychological state, and our social well-being. So all of that comes into play when we think about our mental health. And so just think of it as a way of, how do I relate to others? How do I deal with my stress? And then also of having that positive quality of life.
Okay, anyone want to add?
I guess I'll add, to add on what Shanshira was stating, is that absolutely, when we look at our social emotional well-being, our psychological wellness, oftentimes we misunderstand and think because we have physiological symptoms that it's our physical health. And so that's what I really wanted to add, that oftentimes our mental health well-being, we think that we have a physical problem, and it really can manifest itself in physiological symptoms.
Okay, all right. So in light of that, what are some factors that can contribute to mental health? What are some factors that contribute?
I can tackle that question. And building off of what both Shanshira and Dr. Russ stated, we all have emotional health, and it relates to our underlying biology. So things such as nutrition, sunlight, sleep, those sorts of things, but also, our social interactions with others as well, and the development and anticipation of coping strategies to deal with stress as it arises, as it inevitably will. It also has to do with things such as moods, getting attitudes sometimes with people, interpersonal relationships. How do you get along with others? Are you snapping? Are you mad? Are you getting along peacefully and assuming the best and positive intent from others? So those social interactions happen too. And then obviously stressors happen. There's death, there's loss, there's grief, there's divorce, there's new babies, there's moving, there's all kinds of things that, whether they be good or bad, they're stressful. Those are the things that impact our lives. And just coming up with a proactive, intentional way of managing those vicissitudes and ups and downs of life are some of the things that factor into our overall emotional health and well-being.
Okay. So with that being said, is it something, are we born with our mental health wellness, if you will, or is it something that manifests, like you talked about, death can trigger something? How does that work?
I'll take that. So research-wise, it does not, there's not really any research that really support that we're born with mental health issues. However, there's a lot of research that supports that if there are mental health issues in a family, that there tends to be a familial component if mental health issues, such as depression and so forth, are in the families. And Dr. Wills and Dr. Andrews Gray, feel free to talk, because I know you guys are really abreast of a lot of the research, especially the new stuff that's coming out.
Yeah, and I agree with what Dr. Russ is saying. And I know when we interview a patient, you do a full, a complete history, and you always ask, in your family, has there been anybody with a history of mental illness? And you can't just say mental illness, because as a race, they might not know that. You might have an uncle or a great aunt, they were just a little different, or they were mean, or they isolated, or they talked to themselves, or they drank and it was just funny, or that was the family secret. So those are the type of questions. So there is definitely some familiar part to it, but it's also environment and how you've been treated. Have you been abused in your lifetime? Like Dr. Will said, if how people interact, if a child in school, or were the teachers nice, or were they mean to certain kids and you didn't know why, your child came home quiet, or you start talking to people and asking what is going on. But if you occurring or not.
Okay, so how young can one be diagnosed or identified as having a mental illness or a mental issue?
So behavioral issues in children can manifest as early as age 3 or 4.
Yeah.
And I know that's really difficult for people to truly wrap their heads around. Oftentimes, most people immediately assume, well, it's got to be the parents. But sometimes that's not the case. Sometimes the disorders can manifest at a very, very early age. In fact, half of all psychiatric disorders do manifest by age 24. So, it's on the younger side where people tend to see that. Although, you can start seeing it probably around age 3 or 4.
Okay, so
And I tend to agree with that. Actually, I thought Ms. Townsend was going to jump in for that, but absolutely. And I do also want to share that while most of the time it peaks during the adolescent years, it gets complicated because to Dr. Will's point, oftentimes parents tend to think that it's temper tantrums, or and sometimes providers can miss that because they're thinking and all the way through adolescence saying it's attention seeking behaviors. So we just want to make parents aware, because oftentimes they know their child better than anybody else and their teenager, and when they're seeking assistance and seeking help, then oftentimes they're seeing things that other people are not seeing.
Okay, so what would be some of the look-fors that outside of a tantrum, what are some of those major issues that as a parent of a 3-year-old that I see is acting out and it's different from what a normal 3-year-old, what are some things that I can look for that would be considered out of the ordinary?
Well, I've seen like somatic symptoms, like they're always tummy hurts, or I I don't want to do that, or banging their heads. I've seen cases where the kid was kept stacking stuff and very orderly, like OCD type symptoms, but or they couldn't draw outside of the line, things like that. You know, some things that you say, oh, that's cute or unusual, that, you know, that other children at that same age or their milestones might hit at different times than other children.
So you, what would be the recommendation for a parent to just go see their regular pediatric doctor to?
Well, absolutely, and certainly, you know, making sure that they're writing these things down. You know, trying to also capture like what is happening before and after when this is happening, what place it's happening, because you know you know, I want to be careful because oftentimes these same, you know, these behaviors can kind of get confusing. You know, if I think Dr. Wills and Dr. Andrews Gray was sharing like the fact that if you're moving and if you're, you know, if you got other things going on, a new baby, all those other things,
Okay.
then we don't want you to confuse that with that, oh gosh, my child has a mental health issue.
Okay.
So, you know, so ruling out all those things, if you do see changes in your child behavior, if they're very different, like she said, stacking a lot of blocks and not interacting with other children age appropriately, you know, not playing cooperatively, play around 4 years of old, you know, next to other children, if they're not engaging, you know, so we don't want to confuse that, because also oftentimes too, children have a difficult time with articulating at younger ages versus as they get older. And we also don't want to confuse it with things like autism and so forth as well. So there's so many different diagnoses, and I don't want to, like, you know, I think all of us on the panel being careful about saying these different things, because we don't want parents to start doing this checkbox thing, right?
Right.
And so again, you know, but parents are really intuitive and seek help oftentimes when they feel, I mean, you have that intuition when something's not right. And so I think what, you know, we as part of, you know, the panel are saying that if you feel like something's not right, then make sure that you seek assistance from your child's provider.
All right. So I'm curious. Oh, go ahead, Ann. I'm sorry.
No, that's okay. I just like to add, I couldn't agree with you more, Dr. Russ, in terms of how behaviors might manifest, which may or may not be a result of concerns regarding mental health. And when you mentioned communication, a lot of our youngsters who cannot quite verbalize, I think you said articulate how they feel, what they're experiencing, sometimes it'll manifest in behavioral problems because of their frustration. So when it comes to parents who have those concerns and they listen to their gut and they're just not sure how to proceed, I think it's better to reach out, and to reach out in different venues or to different individuals, right? So we could be reaching out to a pediatrician, a pediatric neurologist, a psychologist or psychiatrist. Reach out to the school, right? Your child is seen by their teacher for up to 6 hours a day, and the teacher can see changes in behavior. There's student services personnel at school. So Mrs. Quinn is supervisor of middle school school counselors. I work with school psychologists. There are also school social workers and school nurses at school sites. And so those teams can collaborate with parents as well as collaborate with private practitioners in the sector. So we kind of do this whole approach and look at wraparound services that we can use and implement to support not just the child, but the environment that the child is in, right? Sometimes just supporting those parents with different strategies to help them reinforce those positive coping mechanisms that they want their children to engage in. Kids can be resilient, but kids also experience trauma. And so we just need to be aware. We just need to be very vigilant in reaching out. And it's okay to say, this is not right and I need help. It's okay to say that.
All right. So could you name, like, categorize some mental illnesses? Because you know, in the beginning I mentioned depression and you know, so but there are other mental illnesses. So could you maybe schizophrenia, like I know those are the major ones that people think of when you think of that, but there are some other ones. Could y'all name some other I guess, diagnosis that would be considered mental illness?
Well, what I'm wondering, are you asking for like from like childhood or, you know, in general? Because we talked a little bit about autism.
Okay, so autism, yes.
There's things like conduct disorder where the child is acting up in school that can turn into, when you're an adult, to something much worse.
Okay.
These are things that you watch out for. The kid that's killing animals, that's the kind of stuff. Those are like the severe things that we talk about and pray that don't help happen. But if you see something like that, you know, that's concerning. Those are the things you watch for. And, you know, the difference between someone that might be on the autistic spectrum versus, you know, true full autism. And so those are things that you have, you know, like I said, you have to have you have to bring in the experts to make sure that those are those diagnoses. I'm an adult, I don't deal with children because it was too difficult. I actually started training in that, and you have to deal with the parents and the kids, and it's a lot. So, but you know, it takes a village, and those are the people you have to talk to. And like you said, the counselors, the teachers, to actually see those other diagnoses. Or is it something they're not eating at home, or is it some type of a vitamin deficiency? I mean, you know, there's so many things that it could be.
So there are a lot. So really, there are a lot of different diagnoses that one person can have when we speak of mental illness. Okay.
Yeah. Also, Angela.
I'm sorry. In this, I just want to share in the school setting. You know, I know that we're seeing a lot of anxiety.
So that's
especially around
right.
COVID-19.
So that's okay.
You know, some panic disorders, some phobias. You know, parents also should be concerned if, you know, if their child is washing their hands. A lot of times they can have like obsessive compulsive kinds of disorders, you know, bipolar, traumatic, post-traumatic stress. You know, you know, I know that, you know, our panel was talking a lot about trauma, you know, and Ms. Townsend and our mental health team and Shinshira, Ms. Quinn, do a lot of education and Act Now and different types of presentations around a lot of the trauma that our students and their families are experiencing.
Okay.
And so, so those are, I don't know if that's what you were looking for.
Yeah, that is like what, what are some, and I know there are so many different ones. Go ahead. I'm sorry, Dr.
In the world of COVID. So like Dr. Russ, the anxiety, COVID fatigue, I'm seeing that a lot with veterans. You know, kids are burnt out, mass, the Zoom. So, you know, that can cause, you know, fear, anxiety, the unknown, what's going to happen. You know, if family members are getting sick from this disease, and then you think it's been 2 years of being locked up, you know, at a home or isolated. And then if they are going to school, it might be a fear of that too.
So you mentioned earlier about when you start interviewing some of your patients, you find out if there was mental illness in the family, and it really wasn't a diagnosis. It's this, they thought uncle such and such, you know, had some issues. What are some reasons why, you know, they weren't diagnosed or they did not receive the mental health care that they probably needed, and just isolated themselves or hid them in a room where they wouldn't come out? You know, maybe like the sister's taking care of the brother and the older brother living in the house. You know, we have that in our families. It was seen on that movie Soul Food, the uncle who never came out of his room because he, you know, he was, you know, quote unquote crazy or whatnot. Why are so few African Americans receiving that health care or diagnosis that they need? And this is to any of the panel.
Well, I'll start it. It's just, as a people, we are taught, you know, to pray it away, or, you know, you're stronger than that, ain't nothing wrong with you, boy. Go, go sit down, or I'll spank you. Sit down. And stop fidgeting. You're not anxious. Suck it up. That's not a man. So that it's different things that we were taught, and that stigma of mental illness. It's in our community.
Yeah.
It should not be a shame, but people are afraid to talk about it.
Right. It's really the stigma. It's that topic is considered taboo to even say that. Like I started at the end. Would you say what do y'all think about lack of health care or lack of insurance? Are those some factors, or even our culture not understanding, or either the culture of a therapist, like going to see a therapist that they could relate to, that may like if you send your child to counseling, it may be that counselor and my child may not connect in a way that is good, because they may not understand the African American culture. Would you all say that that's a factor, or if you had any experience with that?
Well, from a pediatric standpoint, I think it's still somewhat is a factor, and I also think it's generational, because if you look at a lot of schools and curriculums across all the different disciplines, I think they're trying to do a better job with embedding cultural aspects of care. But research-wise, we are finding still there are a lot of biases, and until you're in touch with who you are and what your beliefs are, you can't really help someone else. Because, in order to give the best access to healthcare and the services that one needs, right, we have to understand what our thoughts and beliefs are.
Anyone want to share?
And although we do have, like there is a historical element to like the stigma and things as it relates, but right now there's also long wait lists. So people are, sometimes they seek help, and then like you said, they may run into a counselor that's not a good fit. And so they throw their hands up like, okay, well, this doesn't work. Or they start counseling and they don't see like an immediate result. And so they're just like, okay, this is not for me, or I don't want to tell all my business to this person and all that kind of. Yeah. So it's almost like when we just have to really do a better job of educating them, not just, say, go get counseling, but educating them on the process. And what does it look like? What is it going to take? How long is going to take to feel better and things like that? So I think that sometimes we do seek that help, but if it's not immediate, we just kind of throw that to the side. Like they can't really help me. You can't help me, and so then just go back into that. Okay, I need to just pray harder, or, doing different things that we've been told to do, as a culture in the past.
That's good. So I hear what I hear you saying, and I want to know from your experience, what you just said, it kind of sparked something in me about telling your business, because, we're always taught, what stays in this house, what goes on in this house stays in the house, don't share, this is just who we are as a people. Okay. So in your experience with counseling, any of you who are therapists, is it a thing where you feel like it takes a lot for an African American to start opening up and sharing their feelings? Do you see like a difference between your African American patients and your other patients with sharing? And what is that trust, so that they understand about therapists and not be having or that confidentiality part to it? Can you all share with those? Well, it's kind of like twofold question.
I'll jump in and just say, like, I think, and then of course other folks can share as well, but I think like some of the history, our history is, okay, either you get counseling when the social worker is involved, like, you've been, the child is being abused, or, and so sometimes folks begin to associate, counseling with those punitive
like a court order,
actions. Exactly. Like, you're in court now. Now the judge is saying, hey, you have to go to counseling. Okay. So there's just been this history of attaching, getting those type of services with
negativity.
Punitive, like negative experiences.
All right.
So that's what I'm seeing.
Interesting.
And so that's also where that I can't tell you my business. I'm afraid to tell you this because how are you going to use it against me? And so that's what I've seen. And I'm not. And then once you get past that barrier, and again, it goes back to educating and just sharing. This is the process. This is how you can trust me. This is what I have to, share. This is what's going to stay between us. Just building that rapport and making them feel safe with you in order to get to what we need to get to. And I think that in my experience anyway, that has been a little bit more difficult than working with other cultures who are used to being able to go and just talk and tell everything and not worry. Whereas sometimes with us, like there's their mom and dad in the back of their mind. I'm thinking about kids right now who is like, don't be telling what goes on in this house. This is our business. That so just having to get through that.
Yeah, and you say that. I was speaking with a young lady the other day about she was on the phone. I was listening to her conversation. Well, we were in a conversation, and she answered her phone, and she was like, "Oh," after she hung up, she said that she was getting Adderall. Like, and this is an adult. She's like 26, and she was getting Adderall because, and I was like, "Why?" And she was like, "Well, sometimes I just need to relax or something like that." And she said, she's in court trying to get she's getting a divorce and she's going to court, and she didn't want to go to counseling because she didn't want her ex-husband to hold that against her in court. And so rather than going to seek counseling, she looked at that as being punitive. But I'm going to self-medicate with something that I wasn't even prescribed by. I mean, like, she's getting this from someone else. So I saw a question in the chat about, are ADHD and ADHD considered mental disorders, or can they just contribute to mental disorders? And do you have any statistics on suspected number of incarcerated African American or youth who are actually suffering from mental disorder? So those are two questions, if anyone of you all want to take those two.
So ADHD, with or without hyperactivity, so it previously was known as ADD and or ADHD. Yes, it is considered by the Diagnostic and Statistical Manual as a mental health condition. Does it exist in isolation? It might, but it also may be comorbid, and that there may be other mental health conditions that also manifest. I think the key here is these are mental health conditions. They don't define the individual. So it's very important whether we're looking at students, whether we're looking at adults, we see them as people first, people-centered language. So part of what you were talking about, Mrs. Fullwood, in terms of the stigma, is that oftentimes the stigma is perpetuated by those that define the individual by the disability or the mental illness. And I think if we were to shift our mindsets as a group, all of us, shift our mindsets as a group and realize it's an aspect of an individual. They're individuals with mental health disorders who are extremely successful, who have used their own struggles to not only lift themselves up, but to also help increase understanding. Mrs. Quinn, you talked about education being the key. And I think it's the same when we talk about something as specific as ADHD and in school and how it's manifested. So I'm going to go back to that team approach, because it may not be as simple as a prescription for Ritalin, Adderall, or any of the other medications commonly prescribed, or even off-label prescriptions that are used for individuals. I think that has to be administered in conjunction with behavioral supports, right? Providing all sorts of strategies that the individual can use to help them and not rely solely on medication. I think looking at it from the perspective of getting therapy, if therapy is needed as well. So again, sound like a broken record, but not having a disability identify an individual, nor having it be a situation where it's as simple as taking medication. And I am not a medical doctor. Let me disclose that. I think medication does in many respects, have a place of supporting individuals. Absolutely, positively, have personally seen the benefits. I just think it needs to be in conjunction with other types of supports as well.
The second part of that question, Ms. Fullwood, I think I read a study of a few years back, not too long ago, and I think it was like up to like 65, 70% of students, of children in juvenile detention centers were suspected of having mental health issues. And it came out to be about 2,000, somewhere around there, kids a day. You know, so that's a lot of children or adolescents.
So Anne mentioned some things about shifting. So shifting the stigma of mental illness so that people can get the help they need, so that a person doesn't have to feel that they can self-medicate because they're going to be in trouble if they're going to lose their child or not have, you know, rights. So what are some other things, what are some things that we can do to break those barriers, to help understand? I know in schools we've been pushing it, but not only at a younger age, but in the adults, these millennials, these people from ages 15 to 24, like adults, even my age. And I'm going to say I'm 54. So people my age and up who lived during that era where it was a stigma, but now it's, you know, I feel like it's being taught in school. What can we do still to break that stigma amongst African Americans now, like today? What are some things that we need to do now?
Well, I like what you're doing right now,
Yeah.
you know, having just a conversation. And I also love the fact that at my hairdresser, at barbershops, you know, they're now being educated as well to have conversations around mental health, especially in the African American community. So I see Mr. Washington is on, and so he can comment about the barbershops if that's going on. But I think having these open, candid conversations so that we normalize it and understand that mental health concerns are no different than physical health concerns. You know, everybody talks about their diabetes, their medication,
The water and
their
the
high
need.
blood pressure, and so if we start talking about mental health the same way we start talking about our physical health, I think that, we will get there.
Okay. All right.
That's what I was thinking as well, like along those lines, you know, like how we have like health fairs to allow mental health to be a part of those health fairs, you know, like how we go for regular checkups, then that could be a part of that checkup, and bringing the services to them, like you said, talking about it at, you know, the barbershop and different places where you're bringing the information to where people are in their regular life. So it'll seem like it's a normal, regular, you know, part of life, whether it's at school, at work, at church, or like you said, at the barbershop.
Okay.
And building on that, Shanshara, I was going to jump in particularly around church, because as we talked about, that is one of the big coping strategies that we all know is a big part of our community. And I know a lot more churches are doing things like training their deaconesses and deacon boards in mental health first aid, because people feel comfortable going to their family group in church, talking about things that might be going on, and giving those folks the tools to be able to say, okay, this is good, we can pray this away, but you know what, you may need to see a faith-based counselor who then may refer you to a secular counselor or a psychiatrist or whatever. So I think partnerships with churches are really, really good strategies going forward to continue to get the word out in our communities, and in a way that is already safe and normal for us, that we would go to our pastor for those kinds of issues and help.
That's good. I like that. I really like that, because that's the first thing that Dr. Andrews said is like, we gotta pray it away. That and we all know that is our culture. That's instead of seeking the help we need, and even with marriage counseling and other things like that, it's the same issue. It's always and not that that's a bad thing, but I really like the fact that, you know, training the deaconess on that health, that first aid, that mental health first aid to, be able to direct them into the professional world. So when we're looking at, I want to talk about depression, because just in this last week, we've had two young, it just amazes me, and it just upsets me, because, my kids are that age, to feel the need to jump from a building or just commit suicide. What are some signs? What can we do to notice that this person is in distress, that they really need to seek help? We saw posts that, or we heard about posts that the former Miss America had, and that she posted, and then I saw she had a counselor. But what are some things that, as a friend, as someone who's close to her, to say, when I see that, I need to get over there, I need to make it. What are some things that we can do as just a regular person, not a professional like you all, to really get it out, but as a friend, to just help that person, to get them where they need to do? What are some things that we can do?
I think checking in on people, it's, just from the stuff on social media about the young lady, it seemed that she hadn't spoken to people in maybe like 2 days. Is that unlike her? Is there anything different that you're seeing? Is she more quiet? Is she crying? Is she not talking like she usually does? And we don't know her. We don't know. They said she talked some about mental health, but we don't know the whole picture with that.
Right.
Because, and I'm sure it's a lot more to it than turning 30. Some of the things they were speculating, she left a note. So she had it in her mind that she was going to attempt to do this, and succeed to do this.
Right.
So, and to add on to what Dr. Andrews Gray is saying, is that, when you're seeing that difference in behavior, you're seeing them more withdrawn, crying more, not participating in activities, daily living, eating, any of those different signs, or, you haven't heard from a person, so again, making sure that they know that you're there, that you're, and that you're checking on them on a regular basis, are all ways that you can pick up and determine if that person is becoming more and more depressed. And, while you can't predict, who is going to successfully succeed and commit suicide, certainly we have seen this over and over again, is that there are changes in that person's behavior, giving away things that meant a lot to them before, and now they're starting to give way, or they haven't talked to you, and now they call you out of the blue. I mean, all these different things are things that we can pick up on and try to help that person.
All right, so I
Yeah,
have
I'd
a
like to
question.
add, if
Oh,
I may,
go ahead.
if
Go
I
ahead.
may, Mrs. Fuller. So, Dr. Wills, you mentioned mental health first aid, and I would just like to share a little bit about what we're doing in the schools with youth mental health first aid. We do have funds provided by the state to promote mental health. We actually have a mental health team in the district. And so one of the goals, as required by the state, but it was a goal of this district, is to have every employee trained in youth mental health first aid. So they're aware of the signs and the symptoms. Not only are they aware of the signs and the symptoms, but they're also aware of resources. So if you see changes in loved ones, if you see changes in children and your friends and your parents and whoever, who are those trusted adults at the school that you can go to? But even more so, what are some of the resources that can be utilized nationally as well as locally? So we have the Crisis Center of Tampa Bay. You can go online, or you can dial 211, just like back in the old days when we all had landlines and we called 411 for information. You can actually call 211 and get information about local resources for a variety of different concerns or supports. We have the Suicide Prevention Lifeline, 1-800-273-TALK. So I think it's important too that not only friends reach out to loved ones they're concerned about, but also have knowledge of what those resources are in the community. Dr. Russ, you mentioned a little bit about Act Now, and I just want to highlight that and take a minute and talk about it from the student perspective. but we do have our student services personnel along with administrators and other key personnel from school sites who are engaging in conversations with students. And we're looking at students engaged, students who are enrolled in grades 4 and 5. They are having conversations about mental health, resiliency, promoting mental health and resources. Grades 6 through 12, all of the above, what I just mentioned, as well as suicide prevention. And so I think it's very important that the more we talk about this, and I think that's the thing we keep hearing, the more we talk about this, the more we expose, the more we educate, the more we reduce the stigma, the more we know what to look for, and the more we know who we can reach out to ask for help.
Okay. I want to go to the question. Could you reflect on how the Baker Act is being enforced on this group and how that it is affecting people's future being Baker Acted?
So I can briefly talk about the Hillsborough County practice and policy.
And this is Hillsborough County Public Schools, or
Hillsborough County Public Schools. Thank you for clarifying that. The last thing we want is for any individual, particularly a child, to die by suicide. That is the last thing we want. So when we're looking at children who are engaging in behaviors in which they indicate that they want to harm themselves or harm others, we need to make sure that they are safe and that others are safe. There's a formal protocol that's implemented, and we use the Columbia Suicide Severity Rating Scale in order to work with students, get an assessment of previous thoughts, previous attempts, what are resiliency factors that they have available to them, and as best as we can determine what may be the probable level of risk. We have partnerships with Grace Point, Central Florida Behavioral Health, and other agencies that they work with as management agencies in order to link students and families to resources within the community for that support. Now, when it comes to Baker Act specifically, and for children, our district does not have employees that Baker Act students. Rather, we go through the protocol, we go through a process in which we administer the screener, share that information with licensed individuals at the district level who serve as consultants, and they also serve as facilitators for contact with Grace Point. And at that point, if it's determined that Grace Point should come out and do an assessment, then Grace Point will come to the school site and do an assessment. No differently than one might take a child or an adult to Grace Point or any one of our other facilities within the county, or the district within the county for Baker Act. It's not anything that we take lightly. We don't want kids to be traumatized by the process, and there is new legislation on the books that even talks about parameters by which children are to be transported when they're Baker Acted. So what we want to do is help. We don't want to hurt, but we also don't want anyone to die by suicide because we did not act on what seemed to be concerns. And I sometimes feel that it's not known that we have a formal process in place with steps. It's not just done randomly by any individual at a school, kind of following their own process. There is a district approved process that's actually been vetted through University of South Florida and by Nova Southeastern University.
All right, so to my practicing psychiatrists or therapists that we have on this session, what are some strategies, or once someone starts to come to you for therapy, what are some strategies that you recommend for maintaining positive mental health that is outside of medication is one of those things, but outside of that, what are some other things?
Well, once I get their trust and we have that rapport, and that takes more than one visit, we talk about meds, but of course, diet, exercise, to make sure everything in their physical health, if they're diabetic or blood pressure problems, we take all that in considerations when we're considering medicines, because we don't want them to gain more weight if they're on something to worsen it. And, and I tell them, walk, get those endorphins up. If they can't walk, if they're unable to, and they're stuck in the house because of this COVID, if you can you get in your car, put the windows down, go for a drive just to get out, breathe fresh air. And other thing, when we were talking about the Baker Act, we'll also do a safety check. If you're not showing up for appointments, or you haven't heard from a friend, the family hasn't heard, you can get a safety check where the police can go check just to make sure the person is okay. I'm going to Baker Act you if those things happen when if they can't make a good rational decision. This is for an adult. And I'm doing this for both of us because I want to protect both of us, because I don't want you to hurt yourself and you're not making rational decisions. Or we know that they have access to guns. We take all that type of thing into consideration also. So right. I'm sorry I went back to that. But.
No, I appreciate that. That all of that is really relevant to this conversation. So someone in here, Barbara Howard says, when will 988 be active in Florida? Does anyone know what 988 is?
No. It might be a different number for Florida or a different thing, because like Baker Act is something else in others. It's not called the Baker Act in other cities.
Oh, okay. Oh, she said it's a mental health subscription texting service. Something about I don't know. All right. So we talked a lot about medications. And I know Ann is not an advocate for, or she said she's not a proponent or one way or the other, and it is kind of helpful. I know from a personal standpoint, very helpful in one of my child's lives when she was diagnosed with ADD without the hyperactivity, ADHD without the hyperactivity. Okay. And it was very helpful, but she was able to maintain it throughout her college, her college level until even now. And even as adults, some adults I hear talk about how they look back and they feel like that's what they were. And they, as adult, got help, not necessarily with ADHD, but just any mental health. And they're starting to, are y'all seeing a lot of adults, and these are for my therapist, are y'all starting to see more adults getting help? Is it less? What are some of your numbers? Is it, and especially in the African American culture? So I really want to be specific on that.
Mrs. Fullwood, just a point of clarification. I am not opposed to medication.
Okay.
I'm in favor of a combined
You're in favor of it. Okay.
I am not opposed. I have personally seen differences that medication has made in the lives of individuals, not just ADHD, but depression, anxiety. So if I gave that impression in any way, I do want to correct that. Okay. I'm in favor of a combined approach where you're looking at therapeutic, pharmacological, and behavioral interventions. So I just want to get that out.
And I know just from the personal standpoint, in our lives, I know I was a teacher, so I noticed those things in my child, and I was, really going against my husband's will because he did not want that stigma. He didn't want that label on our child. And it wasn't until she went to middle school and started just failing got straight F's, but she wasn't, an unintelligent child. After she got on the medication, she started making straight A's. But it was frustrating for me because it was all about stigma. And this is why I was excited about doing this particular session, is because I feel like as a race, Blacks, we have the stigma and we neglect to get the help that we need to make us whole. You understand what I'm saying? And so so that's why my question is, are y'all seeing an increase based on the awareness now of mental issues that are happening? Are y'all seeing an increase of patients or people seeking help, or any one of you all, are y'all seeing that increase, or is it still the same?
Well, so I absolutely am seeing an increase, and I know in the school district we're seeing increases as well, and I don't know if COVID has exacerbated that, as Dr. Andrews Gray talked about earlier. But I also want to add that, I know all the practicing providers and, counselors and Ms. Townsend personally, and we believe in both, which is what she was saying, is that you need to have both. So it shouldn't just be medication, because oftentimes, medication is prescribed, but there's no counseling, so a combination of both medication and counseling is critical, for anyone mental wellness.
Okay. All right, so we have 5 minutes left, and I just wanted each of you to have one last say, one last thought, and then share, if you will, our private practicing doctors, if you will. You can share your information as and what type of practice that you have, so that if there's anyone in need, you can put your information in the chat. But if you, I'll start with Shanshira. Any last thoughts? Make sure you
had to make sure I unmuted.
That's right.
So, well, my suggestion would be to, of course, have that open mind and educate yourself even on the process of counseling and other support services that you need. And as the doctor said, move your body, exercise, keep in touch with family and friends, make sure you're eating right, taking care of yourself, ask for help, talk about your feelings, especially, to that person that you trust. And, just do something that you're good at, engage in activities and reach out. So that would be my closing thoughts on what we can do, just to support our mental health.
All right, thank you. Dr. Russ?
Shanshira did a beautiful job along with the entire panel, in that, I'm a firm believer in exercise, right? Because it releases all those great endorphins, and movies, great, funny movies, happy movies, and, and just enjoy, and I think also getting a deeper appreciation of yourself, loving yourself. So I think those are the main things that, we can all focus on and do better at, because we can be better for others once we're better to ourselves.
That's right. Thank you. Dr. Wills?
Well, I would just say, again, thank you for hosting this informative panel. Given our history as a people, we were literally, not allowed to have emotions. We weren't allowed to have emotions. So in some ways, we've transmitted a culture of not even knowing what our emotions are, how to even think about processing, getting in touch with, learning what we're feeling. And so taking the time to have conversations like that to help people know it's okay to have emotions. You don't have to stuff them. And then there's trauma, there's trauma that we've been through as a people, and unpacking some of that trauma too. I think it's important that we begin to have these conversations, not only for our own individual health, but for the collective health and advancement of our communities. And so again, thank you for hosting this.
Thank you for bringing that up too. Yes, we have come a long way, and I feel like it is generational. And I'm glad we're able, like you said, to break that. So thank you for that comment. Appreciate it. Dr. Townsend, or sorry, Ms. Townsend. I know. But we keep saying we're speaking it into existence.
Speaking
Okay.
it into being.
Yes, that's
Finish it, right? Make it happen. So thank you for this opportunity, Mrs. Fullwood, Dr. Lewis. And again, I would like to echo everyone who commented before me. It's great to be able to have these conversations to reduce the stigma. Life is a gift. Every single day that we have is a gift. And everybody goes through ups and downs. No one is alone. We all go through ups and downs. The key is going to be finding those healthy ways in which you can cope with the stressors of life, right? And seeking help and knowing it's okay to seek help. So for our parents out there who are concerned about their children who are students in Hillsborough County Public Schools, please reach out to your student services personnel at the school site. For our parents out there whose children attend private schools within Hillsborough County, reach out to Hillsborough County Public Schools. we'd like to be of support with our student services teams. I've placed in the chat box a few links to articles that I think would be helpful to both parents as well as educators in different ways in which parents can promote positive mental health with their youngsters, right? So please reach out. We are here because this is a passion of ours. We want to be of help. And again, thank you for the opportunity to be with you all tonight.
Thank you. And last but not least, Dr. Andrews Gray.
Well, thank you for having me. And one thing I'd like to say, advocate for yourself. If you can't, what everyone is saying, if you can't, a parent, if you feel that your child or even your adult parents need help, have somebody there for you. If you can't do it for yourself, seek help from others, but have somebody advocating for you at that doctor's office, at that social work, at school. Have somebody there to help, to get that, to get help. And yeah, I think the more education that we have, it will benefit everybody, and we'll get rid of the stigma. And the last thing too, don't let anybody speak over your head or talk. If you keep it plain and simple and explain things to people, it goes by a lot. They understand better. And if you don't understand them, stop them and make them explain it to you. But that's when I was saying advocate for yourself.
Okay. All right. Well, thank you so much. On behalf of the FACE team, we have Dr. Lewis, Mr. Henry Washington, who is our coordinator, African American outreach coordinator for Hillsborough County Public Schools. He is the brain behind all of this. So thank him for his vision for our district, and Mercedes Brown, who is our district resource teacher for family and community engagement. On behalf of all of us, we thank you all so much for being with us in this power hour, and it definitely was a power hour. I learned so much. If you want to have this recording, we put our link, our YouTube channel. Go ahead and subscribe to our YouTube channel, and you will be able to share this session with your family, your friends, and anyone else who needs it. But make sure you take the advice of these amazing doctors and panelists on this call to advocate for yourself, exercise, eat right, keep your mental health up. Don't be afraid to talk about it. Don't be afraid to talk to your therapist. You don't have to keep the secrets of the house. They can't share it with them, with anybody anyway. So talk to them, let them know, let it out, let them give you the advice that you need to move forward, to get your life on track. Because, you know, I was always told that suicide is a permanent solution to a temporary problem. Everything can be solved. So, you know, we don't want you to be depressed. We want you to be happy. We want you to live your best life. Like the song say, I'm living my best life. So anyway, with that, I want to thank you all for being with us tonight. And I really enjoyed the conversation. Thank you all.